Thank you. Mr. Messner, you've said that one of the first bills you would support in the Senate is one that protects people with pre-existing conditions from being denied health insurance if the Affordable Care Act is dismantled. But what would that bill look like? Would there be a cap on the amount an insurance company could charge someone with a pre-existing condition? Would there be a list of conditions?
Yeah, I would include several things in that bill. One is nobody should ever be denied health insurance because of a pre-existing condition. Nobody. Now we have time here to deal with this. The Supreme Court is hearing oral arguments for the Affordable Care Act on November 10th. And the way that the Supreme Court operates, there will not be a decision on that case until next May or June. So we have time to provide legislative fixes in case the Supreme Court overturns the ACA. Now, I happen to believe the Supreme Court will not overturn it. You've heard talk about severability during the Amy Coney Barrett hearings, and I do not believe they will overturn the entire law. But we need to have legislation in case they do, protecting people. We need to allow insurance companies to sell insurance across state lines. Senator Shaheen, when she was governor, the health insurance companies in New Hampshire went from 26 to 3 because of the legislation she passed, which resulted in very high health care costs.
And Senator, in 2017, you were in favor of the Medicare for All bill sponsored by Bernie Sanders. In 2019, you opposed that bill, saying, quote, there are faster ways to reach universal coverage by building on the progress of the Affordable Care Act. So if the ACA is gone, what would be your alternative? Would that be Medicare for All?
No, I think there are faster ways to cover people than to put in a whole new system. I think private insurance has worked, but it's working now because of the Affordable Care Act that says to insurance companies that you can't deny people coverage with pre-existing conditions. If my opponent listened to some of the people with pre-existing conditions, and at our first debate, he denied that we had hundreds of thousands of people in New Hampshire with pre-existing conditions. But if he listened to somebody like Dan Faltis from Swansea, who had cancer and a heart condition, who before the Affordable Care Act could not get health insurance, or Chelsea Lewis, whose daughter has tuberous sclerosis, and she would have reached her lifetime caps a long time ago under health insurance before the Affordable Care Act. That's the system that my opponent wants us to go back to.